Indian country. Welcome to a special 1-hour conversation about the current status of the COVID-19 virus in Indian country, and particularly with Montana tribes. I'm David Kenoyer, and this is part of the Department of Health and Human Services We Can Do This campaign. And we have a number of speakers who are joining us, and we're very excited about having a conversation about helping more people understand the importance of the vaccine, of the different vaccines, particularly right with the constantly changing situation that we've been dealing with more than a year now, right from the very beginning. The partners who have brought us together include the We Can Do This campaign, We Can Do This Indian Country, the Rocky Mountain Tribal Leaders Council, and the Indian Health Service. And we're coming to you with our native media partner, Native Roots Radio, who've just been fantastic to work with. But as I was saying, we want to have a conversation, and we would encourage you, as you're watching this, in the comment section of whatever media platform that you're using, to, if you have a question for our presenters as we go through the next hour, put it in the comment section, and if we can get to it, we'll get to it. I want to start first with Dr. Steve Williamson, who is the Chief Medical Officer for the Billings area. Dr. Williamson is a member of the Blackfeet Nation and is joining us from nearby Billings, where you're having a pretty good day weather-wise, Dr. Williamson. It looks like it's in the 60s and kind of sunny. But this has constantly been changing, Doctor. And what right now is top of mind in terms of how COVID-19 is impacting the Billings area and just in general? When people ask you what's going on, what do you tell them?
So first of all, I want to thank you for this platform and having this opportunity to join you. I'm honored to represent the Indian Health Service and the Blackfeet Nation. And for the Billings Area Indian Health Service, right now the big push is vaccination, vaccination, vaccination.
I know it's been 3 or 4 weeks ago where the Indian Health Service announced that it had delivered 1 million doses across Indian country. And when you look at the media, the different online sources, the web sources, the tribal newspapers, tribal newsletters, over the airwaves, the anecdotes, at least the stories, have been pretty positive, right? In the initial uptake of how many doses, how many shots in arms that IHS put in people so quickly. So it's been a pretty positive story across the country in terms of vaccine uptake. Yes?
Absolutely. We started receiving vaccine in the middle of December, and it seemed at the time like we couldn't distribute it fast enough. And the demand was there, we just didn't have the supply. And as the supply started ramping up, we started getting a lot of people vaccinated, not just our Native American, Alaska Native beneficiaries, but we also started including just general members of the community in order to help increase the safety and mitigate the pandemic.
What types of key questions are you hearing from folks who are maybe trying to persuade a relative to come in? What are some of the barriers? What are some of the questions that do come up despite all of the progress in getting the vaccine distributed, whether it was the Pfizer or Moderna or Johnson & Johnson? Now the stories are starting to show, right, that we've got vaccine and we've got appointments and slots open, and we don't have enough people coming to take advantage of that.
Yeah, unfortunately, we had that misstep, I would say, with the Johnson & Johnson vaccine. And now that we've been given the go-ahead to resume providing those vaccines, we're doing that in full force. That pause with distribution of that vaccine had a ripple effect for the other two vaccines. And so now as we've gotten the people that wanted to be vaccinated, now that we've got them completed, it's just a matter of spreading the word that the vaccines are all safe and they're necessary to get that community immunity going.
Exactly. I'm actually down in the Phoenix area on my first work trip in months, and was visiting with the chairman of or actually his title is governor of the Gila River Indian community, and that's exactly what they're talking about is this community immunity concept, literally taking mobile vaccination units now to the community. Right, we've got the clinics. We have now mass vaccine events happening. I saw one coming up in I think it was early June at a tribal casino somewhere in the country. I can't remember off the top of my head where it was, but being very creative, right, in taking this to the people, being more creative with outreach like this. And I'd like to turn now to Molly Wendland, who is the health director for the Little Shell Chippewa tribe in the Great Falls, Montana area. And Molly, thank you so much for joining us. This conversation today is largely focusing on the Montana tribal community, but of course, we don't really have borders in Indian country, and many of the questions and concerns are widespread, of course. But Molly, what's the situation with your tribe right now in COVID-19 and vaccine uptake?
So thanks for having me on. Our situation is much the same as everywhere. We've seen a drastic reduction in members, wanting to get vaccinated. And with the Little Shell tribe, it's a little bit different. We have members all over the country, and so trying to reach everyone and provide access is a little bit difficult. But I think for us, constant communication, like you said, it's a constantly changing issue, and so constant communication is really important for us. But yeah, we've seen a drastic reduction in the number of members that are requesting to get vaccinated, and so for us, trying to come up with unique ways and being, getting the vaccine to them is something that we're really trying to do. We're offering clinics outside of working hours and on weekends, and just providing education and really trying to take vaccine to our members in our different service areas. So, yeah.
Are there some key questions that people have? I mean, when you look down the list of challenges, right? Some people just don't like needles, right? There's some concern that the vaccines, went through a very rapid, right, development and approval process, and may not be safe, I guess is I don't know if that's the word or not. There's misconceptions, right, about that safety, misconceptions about the approvals, misconceptions about a number of things, and rumors online. There is the access question, and there's some people that just want more information, right, about, is it safe for this type of person? Is it safe for that type of person? Do you think there's some key ones that Native people have been bringing to you, or what?
There's not a lot of key questions. I think, the safety is a question, and we just continue to provide education and access. I'm just going to be really honest with you. I think what we're seeing from a lot of our members is just people are exhausted. They're just, like, this is, they just kind of want it to go away, and it's not. And so I think that's kind of what we're seeing, to be quite frank with you. There are some safety questions. We do get a little bit of that, but like I said, just really trying to provide education, and we've done things like show photos of our council receiving the vaccine, and to make people comfortable, and just trying to come up with ways to get the vaccine to people, really.
Right. Well, thank you. Well, I want to remind people what you've tuned into. This is a conversation with a largely Montana focus about the current COVID-19 situation, the pandemic situation in the state of Montana, but really focusing on how can we get shots in more Native people's arms and non-Native family and friends and allies, right? So much has changed with this pandemic, right? From the very beginning. Do I wash my hands? Is it safe to do this? But we know that there's an urge to go back to some sense of how it was before, to be able to have group activities. Funerals have been very difficult no matter what the cause of death, right? To be able to gather together safely indoors. All of those things and those things that as Native people we crave, right? We crave that sense of belonging, that sense of family. Relationships are everything. And so in the messaging, when you hear the We Can Do This campaign, one of the key messages that is happening is not just about my health, right? It's about respecting the community, and it's about all of us in the circle, right? We need to keep the circle strong for the community, for the family, and that's everybody in the circle, right? So this is the We Can Do This campaign, and for more information, wecandothis.hhs.gov. There are a number of resources there. If you click on that, when you go to that website and click on audiences, the American Indian, Alaska Native audiences will come up, and you'll see a number of resources. But to get a flavor of the campaign, let's play one of these messages that talks about coming together and talks about missing out on some of these family and community activities that we've had to do in the last year, and how if we can get more people vaccinated, we can have more of this coming together, whether it's a powwow, whether it's hugging grandma, auntie, you name it, right, that we've missed out on in the last year. So let's listen to this spot.
Making and sharing things I cook with my family. Before the COVID-19 pandemic, my grandkids used to come over every Sunday for dinner, but now it's just Grandpa and me. Vaccines are here and can help protect us from the virus. I plan to get the COVID-19 vaccine, not just for myself, but for my family, and to be able to share what we love with each other again.
We can do this. Learn more at cdc.gov/coronavirus. Brought to you by the U.S. Department of Health and Human Services.
So that's a radio spot, part of the We Can Do This campaign. And for more resources like that, you can go to wecandothis.hhs.gov. And when you see audiences, click on American Indian, Alaska Native, and those sorts of resources will be there. Let me turn, and Steve, Dr. Steve, feel free to jump in too if you have a medical perspective or a community perspective on any of this. But I wanted to turn to Dorothy Dupree, who's beaming in from the beautiful community, a sunny community of Poplar, Montana, on the Fort Peck Indian Reservation. And Dorothy's the former Indian Health Service area director, retired area director for the Billings area, and is a health systems consultant herself, and I'm sure a very young auntie as well, who has different perspectives on this, and is also a consultant to the Rocky Mountain Leaders Council, who is a sponsor, co-partner of this event too. So Dorothy, what's your experience been with the pandemic over the last year and there in Fort Peck, and how do we keep the momentum going?
Well, I hope you can hear me okay. Can you hear me okay?
Mm-hmm.
Okay, great. I come at it from more of a having had COVID perspective. where I think about the effects and the impact it had immediately on my immediate family, particularly my husband, since he was the one who was taking care of me. And I was doing everything I possibly could to stay out of the hospital, because everything I read was once you get into the hospital, it's very difficult to get out. And some of our tribal members experience that. We have one who's been in hospital for almost 8 months now, really wanting to come home, and we want him to come home, but he's just not ready. So I think about that. I think of that whole journey that I went on. The actual rapidity, I knew something was going on. I felt a little tingle in my throat. And the next day, I mean, that was in the afternoon. And the next day when I woke up, I was full-fledged in lungs filled and hard to breathe and not feeling well at all. I immediately went to be tested and tested, but found to be negative. But they did the longer test and then came back a few days later with that I was positive. But one of the things that I haven't heard a lot of people talk about was in that process of waiting to see what the final result was going to be. Somebody briefly mentioned the monoclonal infusion, and I wrote that down. I stayed with it. And when the positive came back, I said, I absolutely want the monoclonal infusion, because that will help to build up antibodies right away. I went through that, and in spite of that, still got very sick. Lasted through, for several weeks, in fact, with what really we call now long haulers, the long haulers effects. So in looking at my family, people being fearful about how quickly it hits, and all of a sudden you're overcome, the confusion about vaccinations and whether I should have a vaccination or not. I know in Montana, my observation with a lot of people and listening to their discussions, even during the monoclonal infusion process, was, well, we're tough. We're not going to get we're not wearing masks. We're not getting the vaccine. We're going to go for herd immunity, that type of thing. And I'm going, oh no, you don't want to do that. That is not the desired outcome. You're going to have desired or undesired outcomes that we have no understanding of how it's going to affect you in the long run when things pop back up. So all of this, and I was talking to my children who are not living in Montana, but from a distance, getting on phone calls and talking about the need and when it will be available in their area and so forth. So it was all of that kind of wrapped around the actual fact that I was exhausted and I was sick, and people were taking care of me. My mother-in-law came from a distance to also help, and that was very helpful, but it exposed her, and I didn't want to expose her. But I believe that the success of the Indian Health Service, getting the vaccinations out, very planned, we're a organized tribal system, healthcare system, and our patients are very familiar with the providers, and that provider familiarity and was also very, very helpful in people trusting when people were recommending. Many of our locations also said we're not following, just everybody who wants, if you're of the age and you want a vaccination, you're welcome to come here and bring your husband, your significant others, your husband's wife, your husband or your wife, and so forth. So that was also, I think, very effective, because people didn't have to wait until they got through that first layer of people who were eligible. Everybody showed and took the vaccination. So the monoclonal infusion, I think, was extremely beneficial to me, but I didn't hear a lot of people talk about that. I found myself having to pursue it very strongly and be my advocate very clearly to providers. And I think that was, I think it saved my life, quite honestly. I believe that I also, having worked in the system and being an administrator in the system for years, being around doctors, I had no problem being assertive and being my own best advocate, where many other people I think would have a little bit of a harder time, a little more shy, not being around providers. And that's where the familiarity, if they weren't familiar specifically with a provider, somebody in their family was and could take them and be there with them and help explain it. So when I talk to people now, it's not about actually the being sick from COVID. It's getting the vaccination, and it hits everybody differently. So we cannot say that any one individual is going to be okay and no adverse symptoms. Many people have no adverse symptoms, and although a few people have had related symptoms to having a vaccination, but it's compared to COVID, the symptom itself from the vaccination that they may have is to a large degree less impactful. You know, for those of us who have COVID, there's this worry at the back of our minds of what next. You know, even though I haven't, I personally have exhaustion, so I'll go through days of feeling really, really good, and then days of boom, something hits and I have to go lay down because I can't keep my eyes open. But you know, I'd rather go through that and have had the vaccination, two of them with Pfizer, and I'm glad I feel relief. And I'd rather have everybody around me that sense of relief. Being here in the distribution system that we have here at Fort Peck for my tribe, we not only have the providers, but we also have the Tribal Health Improvement Program workers that go out into the communities and touch base with people in the communities, as well as do our public health nurses. So we have a lot of that in place, and we can rely on that so people don't get left out. We look for people who need a ride and are willing and wanting a ride to get to a vaccination site. So we have that as well. I think that here at home, when I see a lot of doing my work here, people coming up to me and saying, I've had my vaccinations, and they're very proud of it, and they don't, you know, and I said, well, so have I, and I don't need to wear a mask, and let me give you a hug. You know, maybe that's pushing it a little bit too far, but we're very huggy people. And it's just nice to see our friends who are healthy and are vaccinated and feeling this sense of relief. I think if people who fear the COVID, who fear the vaccinations already, if they could just believe in the sense of relief that is there, and do for the family, for the love of the family, get the vaccinations. I know for me, it was the support that I received from my daughter, who is a nurse, and driving me to the vaccination. It just gave us time to be together and to do something that we will never forget. There will always be that memory that's there of the love and the support that we have, and that love and support that we have as a tribe. Also, we have that feeling as well.
Well, we're glad you're feeling better. You certainly look great. So thank you for your story, your personal story, and your observations. Dr. Williamson, did you want to weigh in on anything that Dorothy Dupree just mentioned in terms of the monoclonal antibodies or other vaccine thoughts?
I just want to reassure everybody in the Billings area that we do have access to the monoclonal antibody therapy, and we have up to 14 days after you test positive, or at least begin to have symptoms, to give you that medicine. And if our facility does not have it by chance, then we are able to access other facilities, and we can get that taken care of for you. So I'm very glad that Dorothy was persistent and that she was able to utilize that medication, and I firmly believe that it helped her as well. And also, just a little touch a little bit on the incentive. I see in the comments that the 18 to 39-year-old age group, they're the ones who do not want to be vaccinated. And so we've been trying to figure out ways to incentivize the vaccine, and the tribal leaders have really been instrumental in doing that, offering gas cards or what have you, but they're also encouraging their tribal members to get vaccinated so that they can participate in summer powwows, rodeos, family get-togethers, and not be afraid of catching the infection.
Exactly. Let me bring another speaker into the conversation here. And joining us on the telephone is Chairman Gerald Gray Jr. of the Little Shell Tribe, Chippewa there, who works with Molly Wendland, who we heard from earlier. Chairman Gray, thank you for joining us. What is the status of COVID-19 with your community?
Yeah, thank you for having me, David. Right now, like Molly said, I think we're pretty lucky for Little Shell. I mean, in the beginning of this pandemic, we had issued a emergency declaration right away. I think we were the second tribe in Montana to do.
Did we lose Gerald altogether, or was that just me? Sounds like we lost his signal there. If we can get him back, somebody let me know. I wanted to also give you all a resource. If you've got questions about the vaccine, there's much information at a website, vaccines.gov. Vaccines, vaccines.gov. And whether it's the questions about the safety, the authorization process, all of the trials, the clinical trials that have happened, many of which have involved American Indian and Alaska Native people. I myself received my second Moderna shot on Friday, 6 days ago, yesterday, and I still have my Band-Aid here that I would show you if I could roll these sleeves up, but I can't. It was the second shot of the Moderna, and like the first shot, the main symptom for me was just a really sore arm. And I don't know if that's, you'd think I'd have more muscles the sore it got, but I don't really have many muscles in this 50-something-year-old arm. And I had slight chills that first night. Slight chills when I was going to bed that night. I got the vaccine at about 10:30 in the morning, and I was fine other than sore arm until some chills. And the next day I was just kind of tired, but it was hard to tell if that was, waiting for winter to get over and get warm and get outside and get some stuff done. But I did feel not quite myself for, maybe 24 or 36 hours, but that was it. I was very lucky, and, no other flu-like symptoms or what have you. So it worked for me, and I got vaccinated because I wanted to get on airplanes and not worry about it. I haven't seen my parents since April of 2020, and they're in their 70s, and didn't really want to expose them to, what I might get off on an airplane to go see them. Both my children have received their vaccines. They are 19 and 21 years old. The 21-year-old has had her second shot, and she had some, cold flu-like symptoms herself, and then the 19-year-old is getting her second shot in a couple days. So for our immediate family, it's gone relatively well. Both my parents have been vaccinated in their 70s. My father is diabetic and been very careful, right, about some of those social distancing, mask wearing behaviors, and he's been well. My mom's been well, so that's awesome. Is Chairman Gray back with us?
Yes, I am. Sorry about
Yes.
that.
Yeah. So how's it going with your nation, Chairman, and how do we get more shots in arms?
That's a good question, David. So for the little shell, I don't know where I dropped off at, but we were pretty lucky during this pandemic in the sense that we issued a emergency declaration right off the bat. I think we're the second tribe in Montana that had done so, and that really helped because it put a lot of things on hold for the tribe, and I think it kind of sent the message to our membership that this is pretty serious. And so far, I think to date, we maybe had only lost one tribal member to COVID. To get more vaccinations, that's a good question. That's something that the council and Molly and with Molly trying to just determine the best way to get more people vaccinated. We were thinking about the incentive route. Something that we're definitely take a look at, and that might be the way to go in terms of getting more people vaccinated. I also think that once the either Moderna or Johnson Johnson is approved for the younger population, I think then we'll start to see more vaccinations in the arm, so to speak.
Yes. It might help just to be able to have that one shot, right, that the Johnson & Johnson vaccine is about. Any comments on what some of the barriers are or what you've heard from the conversation so far? Any of our speakers, Molly, Dr. Steve, Dorothy. Dorothy, what do you think are some of the biggest barriers for Native people?
Well, I think that when you compare the availability when they were available, people were for the Indian Health Service said, "Come one, come all, bring your family members." On the outside, I think the confusion is I'm waiting and I'm waiting and I'm waiting, and then they call and there's difficulty getting an appointment coming in. So all of that works against the flow of having access to vaccinations when they are available. And as a result, we've had some facilities in the private sector that have an excess and they have to use them up in a day or so, or not a day or so, but within the time frame, and they don't have the people at the door because it is confusing. So I think that was part of it. I think in the Indian world, for us here too, that we think of the history of what's happened to us when we were long ago, and the smallpox and things like that. And it's difficult to trust. Again, I think the benefit of the Indian Health Service and the providers and tribal programs as well, as that we're familiar with the providers, and they wouldn't hurt us. So that was the offset of that. I think rumors were a large part of it. There's so much on the radio, on the TV about X, Y, and Z and all of it. And finally, my husband said, "I'm just going to turn off the TV. I can't listen to this anymore. I just have to go with what I know." And he did, so, but there were many, many people like him. It was just very confusing, too many differing opinions, some scare factors thrown in and all of that. So I think as time goes on and we really see the research and the positives that come out of this, and that we're back to re-engaging in our powwows and our families and so forth. I think that would be the real positiveness of the vaccination and the stories that are told, because you see it there in front of you.
Right. And things have changed. At one point, right, the national conversation was largely about herd immunity. Let's get so much percentage of the population vaccinated or have been exposed to COVID-19, right? So that there are fewer people who haven't been touched, that the virus will stop spreading. But now we're learning, right, that with these new variants, the British variant and the other variants, the virus has changed and mutated as it's spread, and herd immunity is going to be more challenging across the board. But that doesn't mean we can't have herd immunity in poplar, or herd immunity in lame deer, or herd immunity in crow agency. I'm wearing my crow bling for this conversation today. But how do we get there? And one of the ways we get there is to talk about the circle, to talk about us, as a people. As you said, Dorothy, we take care of each other, right? We respect our elders. We want our little ones vaccinated and safe, because we know that if not all of us are, right, it's all of us really, or none of us in some respects. We are about we. We have a collective value about us. And along those lines, let me play for all of us another message, a radio message from the We Can Do This campaign. And this, again, is this yearning for coming together, this yearning for cultural and family activities, family reunions, even going to church, right, for a lot of people has been impossible, or going to a ceremony has been difficult. So let's hear another spot produced by G&G Advertising, based in Billings, Montana, for the We Can Do This COVID campaign.
We would gather in my grandfather's kitchen and hear stories from our elders. We learned of our history, our traditions, and how we got through the many challenges we have faced. Today, I am that storyteller. Vaccines are here for the COVID-19 pandemic. As keepers of our traditions and stories, we must make sure we get the vaccines to preserve our culture for generations to come.
We can do this. Learn more at cdc.gov/coronavirus. Brought to you by the U.S. Department of Health and Human Services.
For more information, you can go to wecandothis.hhs.gov. And when you see the audience tab, click on American Indian Alaska Native for more resources and more information that you can use in your community. Molly Wendland, earlier you talked about a sense of fatigue, right? And there was fatigue even before the vaccines came along, right? We were tired of not being able to go to restaurants. Some people were a little tired of their masks, and we know the mask isn't necessarily the most convenient thing to wear, but right, a mask protects me, and it also protects any germs that I may have from spreading those to people. But there's been fatigue for a while, a sense, right, that we want it to be over, maybe a sense that this was a race, and Indian people, whether it's a horse race or a basketball game or an athletic race, because running is a big part of our traditions, whether it's the Yellowbird organization in Lame Deer that runs that 400-mile youth race from Nebraska back to the reservation in Montana every January, 400 miles in winter. Running is a big part of what we do, and yet this goal line keeps shifting a little bit, right? Herd immunity is going to be more challenging, and we just don't have a total fix yet, right? We're going to have to live with this in some way, shape, or form for an undetermined amount of time. How do you have those conversations with people, or how do your providers there in the clinic do that?
So our clinic is just gonna open in August, but yeah, having those conversations, you just I really like what Dorothy said about we do it for each other, and to have that conversation, and I like how like there was some conflicting information and people were confused. We, like everyone, all other tribes open it up to not just our members, but we encouraged, their spouses and other family members that worked closely with them and lived with them to come in and get vaccinated too. And so, like I said, again, I think constant communication is really what we've been trying to do with our members and provide education. I think that's important. There's so much conflicting information out there, like everyone has said. And so, there's different information and different opinions. And so just encouraging our members to call in and visit with us is what we've done too. We have, a care coordinator that's dedicated to all things COVID. And so she's, talk to a lot of members and just keep advocating for, safe and we do it for each other. I think that's, having those conversations is important. And just I know people are probably sort of tired of our, of our posts and our social media and our communication, but I think we just keep having this conversation. It's important.
Dr. Williamson, what kinds of creative outreach have you heard of, even Montana and beyond? Certainly there's signs on the highway. The mass vaccination event that I had mentioned earlier is going to be in the Upper Sioux community in Minnesota in a few weeks. And there have been mass vaccination events all over the place, drive-by vaccinations. What else are you hearing that people are trying? We heard earlier incentives. And we got to try a lot of things, right? There's just not one size fits all here, no silver bullets. Dr. Steve is muted. I don't know if that's on our end or his end.
How's that?
Yeah, you're back.
Okay, thank you. So for me personally, I wouldn't be a physician if it wasn't for the encouragement that was given to me by my grandfather. A lot of people, encouraged me along the way, but his words were the most important to me. And so I cannot stress how important it is for our tribal leaders, our tribal elders, to encourage the younger people to get this vaccine done, because it means a lot to the younger generation to hear it coming from our leaders and our elders. And the incentive is, if I'm going to get the vaccine, it's not going to be necessarily for me. It's going to be for my loved ones, my parents, my family, my aunts, uncles, grandmas, grandpas. We want to keep everybody as healthy as possible and around for as long as possible, because our elders carry a lot of knowledge and experience in history, and we need that.
Thank you. And I think from the beginning, right, the campaign, the We Can Do This campaign, has evolved too. And it's working in waves and phases, if you will. And nationally, the first wave focused on elders and senior citizens. That's every community, right? The Black African American community, the Hispanic, and so forth. And in Indian country, we were lucky to say, we put our elders first already. They're first in line, which was, pretty cool. And similarly, the messages are starting to shift at the national level from, go do this to stay healthy for you, to go get a vaccine, not just for you, but for everybody around you, for the community, for your teammates, for your coworkers, for of course, your elders. But this isn't a horse race, right? Keeping the circle strong involves everybody in that circle being a leader in some way, right? Participatory leadership, a contribution to the circle. And if a virus is going to adapt and things are going to keep changing, we need all the brilliance and the smarts and the minds. We need to bring our minds together in that circle, right, in order to keep adapting and innovating and coming up with new ways to ultimately win this fight. But if the fight keeps changing, right, we've got to keep trying new things. And it is exhausting. It is exhausting. Dorothy, you seem to be quite at peace, having gone through contracting COVID yourself, and your story of your daughter being a source of strength for you, that milestone of going and getting a vaccine and how good that felt. How do we keep people's spirits up during this? And it probably will help to go have some powwow time and, that again, but it's never going to be exactly how it was, right?
Right. And, and some of my my thoughts about that is that there are some activities that became available. For example, we had Zoom meetings and about any topic. You can. I joined a Zoom meeting about the geological formation of the Lewis and Clark caverns, for example. I never would have participated in that. I never would have made the journey there. But, so there were things coming out like that, a series of this every Friday evening. And it was really fun, actually, to be able to log on to that on your computer and participate and ask questions and so forth. It was very fulfilling. More of that, I think, is on the horizon. I also like the cleaning standards that everybody started to participate in. Everywhere you go, everything's cleaner than it's ever been. And I love that. And I hope that doesn't go away. I hope it continues. And, my family makes fun of me because they think that I'm such an OCD person when it comes to cleaning. Everything is, my husband complains because I'm picking up his coffee cup if he walks away from it for a half a minute. It's already washed and cleaned and put away. And, but, you have to look at life, and it's an experience, it's a journey. And the personal attitude of maybe being angry or something like that doesn't do us any good. It's frustrating, yes, but we can get through this. And that's why I really like that we can do this. And we can get through this. I think that there are a few things that we've learned along the way as well about, what we need to continue to work on as tribes when we feel that we've beat the odds. And that is data. We need data, and we rely on tribal data, but we don't collect data that well. And I think that's a focus that we as tribes in Montana and Wyoming need to focus on, is how do we build our better data systems so that we know where we are when we know when we're successful. We try to go by data, but we hear more about people getting vaccinated, but our data doesn't show that. So we need to do a better job with data. I also think I saw Cindy Washaki's comment really about what they're doing in Wyoming, that the direct service tribe and the tribal program are working together, and each of them are providing vaccinations. So each of them, in their ability to reach out and treat or vaccinate not only tribal members, but non-tribal members as well. I think it's also a success story for what Blackfeet and our tribe also experiences, that we're able to reach across the borders. For anything that we don't want to let go and go to waste, we reach out to our tribal members in Canada who will meet us at the border and get vaccinated. I think that's a wonderful, wonderful show of tribalness and family, because that border doesn't stop us caring about people in Canada. And we found ways to get around that and to really provide vaccinations to them as well. We can't collect that data. Well, maybe it'll be not counted for the United States, but it certainly can be counted for our tribe and be collected that way as well, and be also showing that experience. So I think those things, I used to look at foreigners who were traveling, because I traveled a lot, and many of the foreigners, particularly from Asian foreigners, were wearing masks all the time. It just seemed to be a standard, and it didn't change. And then I found myself wearing masks. I'm going, oh, I'm just one of the group now, and protecting. And I think those masks, as a matter of just protocol, are a good thing. I know people don't like the masks, but I think they protect me, and I feel more comfortable of not spreading something if I come into contact with it. The hand washing, I think, has always been there for a cold season, and I think we've upped the game on that one, and I hope that continues as well. So I think there's positives, and I think there's negatives, and I think that we have an obligation for our own mental health to keep upbeat. So, there are other things we can do. Sign on YouTube and do exercise. That's another biggie, because there's a lot of that happening. Sign on and share stories, and there's a lot of that happening. So, these new things that have come across now as part of our tapping into has been very exciting. And we could become part of that too. We could do our own videos like we're doing now, and share our knowledge and share our experience and talk about our fears and so forth. That will eventually be a happy point in our lives.
Yes. And I think you're right. Those positive stories do give us energy. They're energizing to see the cooperation with the Blackfeet Nation that goes up into Canada, call them blood people, call them Piikani. They're all the same people, right? They're just different political entities. To see the Indian Health Service clinic and the tribally run clinic at Wind River cooperating, to see these wonderful stories of the Indian Health Service, Dr. Williamson, getting positive headlines, has been wonderful to see, right? Instead of the often stories of being underfunded and having to limit services and running out of money, in June or July at the end of the fiscal year. So thank you for your hard work. And it's must be kind of nice to see that IHS get some good press in the last few months.
Thank you. I'm really proud of all the healthcare workers in our region, not only at our federal facilities, but also with our partners in the tribal healthcare facilities and our urban Indian organizations. We've all been working together to reach that similar goal for healthier communities.
What are next steps in the Billings area with IHS? What's on the horizon?
So as researchers learn more about this particular virus, we'll continue to adapt to new guidelines, new recommendations. There's research going on every day. And so we'll continue to adapt as we have been over the previous year and 3 months, or what have you, just as the rest of the world has had to deal with this pandemic. And so, just as the priorities have changed initially, from prevention and then moved to testing and treatment and vaccination, now we're just going to continue moving forward.
Awesome. Molly Wendland, thank you for joining us today. It sounds like your new clinic is coming online there, and I know there's a different clinic there in Great Falls. Any final words as we end this discussion for now?
I just think that we have to continue to work together and continue to communicate and advocate for each other. And again, like Dorothy said, we do it for each other. So, yeah.
Awesome. Well, this conversation has been brought to you by the We Can Do This campaign. For more information, you can go to wecandothis.hhs.gov, the Department of Health and Human Services at the federal level. It's working hard to make vaccines available to more of us, right? The next group of people to be opened this up to will be all teenagers very soon. So that's coming. It's really exciting to see our tribal clinics not only serve urban Indians, who've been able to get to the reservation, but even non-natives in places like Oklahoma and elsewhere. I've seen on Facebook friends of mine who went down to the Citizen Potawatomi or Chickasaw Clinic, and there was vaccine available. I know in Alaska, some of the regional corporations up there have been vaccinating teachers and frontline workers who are non-native for weeks now. So those are wonderful stories of us coming together. So really appreciate Dr. Williamson joining us, Molly, Chairman Gray of the Little Shell Tribe of Chippewa Indians. For more information, vaccines.gov. I got my second Moderna shot 6 days ago, and so far so good. Dorothy Dupree, you're been wonderful here, and we really appreciate your peaceful and soothing commentary. And I'm going to give you the last word as we say goodbye for this time, and we will have future conversations. And since you've had such a good time, Dorothy, we might have to bring you back as an honorary member of the Great Lakes, where we're going to hopefully be there in a couple weeks, and then the Southwest. Any final thoughts, Dorothy?
Oh, I do want to mention that we do have a partner, and they deserve recognition as well, and that's the National Indian Health Board. They have downloadable material that's tailored to our population, and getting access it and downloading it, distributing it, I think is just very useful and helpful. So I don't want to go without mentioning them. We have many partners, lots of partners in the States as well. The other thing, I just leave it with a fun little thought. We've had more natives in commercials during the COVID period. So we really need to advocate with the states to really include us in all commercials because it resonates, and we get that community that really needs to see us as people, and not just something to study, but actual people. And I know I talked to Steve about his commercial that he was in, and people have asked me, who is that guy that, he's native and he's wearing this nice suit that you can tell he's native. Who is he? And I'm saying, well, he's Blackfeet, number one. And number two, he's the chief medical officer. So thank you, Stephen, for all your leadership that you've provided. And I really appreciate Molly. Congratulations as being a federally recognized tribe and all the work that you do. Startup is not easy, but you've got lots of people who are cheering for you and lots of partners who can help in the process. So thank you so much. And thank you for putting on the show, because we can do this. We will do this. We can do it. So thank you.
Dorothy, I think you need an agent. I know Dr. Williamson could use an agent, and I think we can make that happen. So we're going to see all of you again. Thanks for joining us. Have a great evening, and let's talk, right? Let's just ask questions and encourage each other to keep the circle strong. Thank you all.
Yes.
Good night.
Thank you.